and methods from other places.
Members' motion with no legislative effect. Ms. Rebecca Chan will move a motion on 10-year plan for primary health care. 7 members will move amendments to the motion. This council will proceed to a joint debate on the motion and the amendments. Later, I will first call upon Ms. Rebecca Chan to speak and move the motion. Then I will call upon Mr. Kingsley Wong, Mr. Edward Leung, Dr. David Lam, Mr. Tommy Cheung, Mr. Duncan CHIU, Ms. Judy Chan, and Ms. Eunice Yong to speak in sequence, but they may not move the amendments at this stage. The joint debate now begins. Members who wish to speak, please press the request to speak button. I now call upon Ms. Rebecca Chan to speak and move the motion. Ms. Rebecca Chan. President, I move that the motion as printed on the agenda be passed. That is the motion on 10-year plan for primary healthcare. I believe many members and members of the public would agree that Hong Kong's healthcare system faces a number of long-standing issues that remain unsolved. In order to tackle these issues, primary healthcare is one of the directions to go. Under the COVID-19 pandemic, some hospitals had to focus their energies on COVID patients, and a lot of emergency services had to be suspended, and delays in patients' treatment highlighted the importance of developing primary healthcare in the community. Primary healthcare is nothing new, but for years, Hong Kong's healthcare system has been focused on treatment instead of prevention. And that is why we have not created a comprehensive primary healthcare network. And this is due to the fact that we lack a comprehensive primary care policy. Primary healthcare is more than just a slogan. We must identify the crux of the issues, and the 10-year plan for primary healthcare must tackle these core issues head on. First, our healthcare services are under stress. In terms of the waiting time for specialist outpatient services, according to the Hospital Authority, for the Kowloon Central Cluster ENT ophthalmology, the waiting time is as long as 3 years, which is unacceptable. Whereas at A&E wards and medicine wards of public hospitals before COVID-19, during the flu surge, there were on average 6,000 patients per day, or between 6,000 to 7,000. For the medicine wards, even given the extra beds utilization reached 120%. This is due to the fact that we do not have a community primary healthcare network, and that is why patients flock to public hospitals, imposing a great burden on the hospitals, and this in turn affects service quality. Another issue is the rising costs of healthcare. According to government figures, in 2011 to 12, government allocation to the HA was $36.8 billion. In 2021 to 22, the figure was $82.4 billion. The rise was 124% over 10 years, so it was substantial. Over the past 10 years, we saw new hospitals and manpower was strengthened and funding was increased as well. But has service quality improved as a result of the funding allocation? This is something we must think about. According to the Jockey Club Primary Healthcare Center, every $1 spent on community healthcare will lead to savings of $8.4 in public healthcare. So developing primary healthcare is the only way to go. Through this 10-year plan, the government should develop a comprehensive primary healthcare network in the community. There should be a blueprint to cover 3 work areas. focus should be placed on prevention, and the government should come up with a blueprint. And this should include quantifiable targets and service development strategies, such as the number of family doctors and community clinics to be introduced across 10 years, and the number of cross-disciplinary healthcare units serving the community, follow-up services, etc. With these indicators in place, we can dovetail with the manpower projections. That way, there will not be a competition for talent between different industries. The 10-year plan should also cover these areas. First, triage of patients. It is important to conduct triage of the patients. I think the district health centers were one such example. And we saw a number of DHCs and DHC Express put in operation. However, due to a lack of publicity, the district health centers are yet to fully fulfill their potential. The model of public-private partnership is somewhat beneficial, but given the lack of primary healthcare support, the service provision on a community level is still lacking. The government should specify the basic services to be provided by the DHCs, such as health checks, community pharmacies, dental services, etc. And district-based value-added services should also be offered. These services should consider the demand for specialist outpatient services in the region. For Kowloon Center, for the ENT and ophthalmology specialties, waiting time is very long. And the DHC in the district should pinpoint the issue, and together with the mobile clinics, various community services should be provided, including Chinese medicine, dermatology, vaccination, etc. And this would reinforce the patient care capabilities, and this would also relieve the burden on hospitals. Secondly, we should make the best use of our manpower. Since 2017, the government would publish a healthcare manpower planning report every 3 years, but we have still been using the old projection basis in estimating the manpower needs for the next 10 years. There were calls that such projections do not reflect the actual situation, so the government should adjust the manpower planning strategy, and training for family doctors should be reinforced since they are the gatekeepers. We should also step up the training of specialists, such as Chinese medicine professionals, pharmacists. Interdisciplinary teams should be deployed to serve patients and relieve the burden on public hospitals. The third area of work is to promote universal health. Like I said in my original motion, health indicators should be set. This can raise people's awareness of health, and I will later speak on these points. The government will conduct public consultation on a primary healthcare plan. Apart from the points I just mentioned, the government should consider setting up a dedicated department or even a commissioner for primary healthcare in order to fulfill the goals of the plan. And there should be an integration of resources with public healthcare. That way, our healthcare system would be more focused on prevention than treatment. That would be the solution to our problems. I now propose a question to you that Ms. Rebecca Chan's motion be passed.
Mr. Kingsley Wong. President, I'd like to declare that I'm actually a member for one of association for medical health care, and we of course must focus more on health. The best situation is to remain healthy even if we are ill or suffering from discomfort. Then we must try to treat it as soon as possible. So that is actually the concept of primary health care, to just try to treat small illnesses and not wait till it becomes very serious. But then Hong Kong has always been treatment oriented and not prevention focused, and would only wait till you suffer from serious disease before you seek care, and therefore it has brought along huge pressure on the healthcare system. Therefore, I agree with Ms. Chan Hoi-yan's motion on a 10-year plan for primary health care. Actually, there is a huge need for specialists, especially for optometry, and also you can see that there's actually about have to waiting of over 120 weeks. So the waiting time is very long, yet the doctor diagnosis is only very short. Therefore, patients do not actually have appropriate treatment in a timely manner. Therefore, you can see a very huge pressure on hospitals and in clinics in Hong Kong. This is the reason why healthcare is becoming more expensive. Therefore, we recommend the government to focus more on prevention and not only on treatment. For example, on lung cancer, it's actually the #1 killer in Hong Kong in 2019. There are about 40,000 people dying of lung cancer. That's 20% of all mortalities in lung cancer. So those who smoke or those with family history should join a screening to identify it at an early stage, and treatment can thus be provided. So I suggest that we should have a universal physical checkup program and also screening for cancer, so as to prevent the occurrence of serious illnesses, as that will also reduce the cost for medical care. Chinese medicine also plays a very important role because it can also treat many serious illnesses. So a good doctor is not only to treat a illness, instead to actually prevent a patient from being sick. Chinese medicine has been very effective in curing illnesses such as COVID, and for actually providing care for cancer patients and to relieve the pain these patients go through. So Chinese medicine should also be included in primary healthcare because it can also relieve the pressure on the overall healthcare system. Chinese medicine has been trying to become more important, and the government should proactively include Chinese medicine in primary healthcare so that Chinese medicine can play a more important role in the system. We also suggest that the elderly healthcare voucher be lowered to 60 because that can really help the elderly identify illnesses. Those who are about 60 years of age do not suffer from as many illnesses, and so there should be a universal physical checkup program to help those who are about 60, and we should also encourage the elderly to be vaccinated as soon as possible. We should also train more medical staff, and that is actually the way forward for us. I so submit. Mr. Edward Leung. Thank you, President. The public healthcare system in Hong Kong has been facing huge pressure, And it is stated very clearly in the original motion that the waiting time for outpatient services remain at a high level. Well, I'm not going to focus on how pitiful the situation is. I agree with the original motion that we should enhance the public healthcare system and to focus more on prevention instead of treatment-oriented. We always say that prevention is better than cure because the cost of prevention is much lower than that of treatment. The original motion has given us some suggestions, and there are a few points I would like to highlight. We do see an imbalance of services in public and private services. Secondly, Chinese medicine has been neglected. And thirdly, on the insufficient manpower. Although it seems that I'm raising many issues, however, as long as we are determined to work on this, I'm sure we'll be able to resolve these issues one by one. The first issue is on the imbalance on public and private health care. I suggest to try to make optimal use of private healthcare resources so that members of the public can receive public healthcare in a timely manner. And that will actually relieve the pressure on hospital admission, releasing manpower to provide better care for patients. How can we, within a short period of time, really improve our health care? We must try to make good use of our private healthcare resources. Through our experience in cooperation, we see that the private healthcare services can try to relieve the pressure on the public healthcare system, and patients can receive care at an earlier stage. For example, on cataract surgery, it's a very good example. A cooperation must be needed. The government needs to integrate private healthcare into the development of healthcare. And we've been neglecting Chinese medicine practice for many years. We should fully incorporate Chinese medicine services into the public healthcare system and to develop comprehensive integrated Chinese Western medicine services. Although in the 2018 policy address, the CE suggested integration of Chinese and Western medicine services, if you pay close attention, you would see that the government has never committed to integrating Chinese Western medicine services into the public healthcare system. Therefore, you would not be able to receive Chinese medicine service in public healthcare. And according to the CHP and the Hospital Authority, there are around 10,000 Chinese medicine practitioners, but only less than 10% of them work in the public healthcare system. We should integrate these resources into the public healthcare system, and that would help us to become stronger in healthcare system, and members of the public will have another option. Thirdly, on insufficient manpower. How can we provide better healthcare services without sufficient manpower? Only 2 universities in Hong Kong train doctors, and only 4 universities provide nurse training. Faced with the pressure on healthcare system, that is really not enough. In order to break through this bottleneck, we suggest the government to set up a 3rd medical school to train more healthcare personnel to ameliorate the problem of inadequate frontline healthcare manpower. Lastly, President and colleagues, my amendment is a hope to improve our healthcare services in Hong Kong. I hope you will support my motion. I so submit. Thank you, President. Dr. David Lam. Thank you, Ms. Chen Hoi-yan, for raising this important issue. With an aging population, more and more people will be suffering from diabetes, high blood pressure, And for high cholesterol, you would see that in 30 years old to 44 years olds. A patient or an elderly patient would suffer from all these illnesses. And if you want to visit a specialist within the public healthcare system, you would need to go about 9 visits. And for diabetes, you will need to conduct a blood test for about 10 times. For the elderly who are not able to visit the hospital by himself or herself, then the daughter or son may have to accompany the elderly to make this hospital visit. The elderly may think that this is the only option. They may not want to go to hospital so many times a year. We should try to triage the patients within the community level. The family doctor should be the general manager of our health. And to maintain our health, but if the illness aggravates, then the family doctor can then refer the patient back to the specialist. The elderly do not know how long the waiting time is for public hospitals, and therefore they are not willing to visit private doctors. So in the STPOP, we've already started doing that, but then it is still slow, and we hope that we'll be able to push this forward so that we'll be able to have specialists and family doctors providing co-care to patients. The hospitals and the community can then also work together to provide better service for the patients. Let's say a patient suffers from stroke, and after discharge from hospital, the patient, after moving back into the community, still needs someone to assist him. And because many of the elderly do not have someone to take care of them, then they would remain in hospital for a longer period of time, and that would have actually a huge burden on our hospital beds. We should actually move these patients back into the community so that there would also be services done at the community level. We at the community level should set up a community hospital so that the elderly can stay in the community and have their issues taken care of at that level. And it should be managed at the community level. I'm very happy that the district health centers are starting that, but then we must have registered nurses and doctors. I hope the government will consider setting up a department or an organization to manage a community and hospital partnership. There are many family doctors, but we are just a service provider. We do not have a system. We provide the elderly health care voucher. So the money goes with the patient. We also have the e-health. We want each person in Hong Kong to have their own medical records. So that has already set up the infrastructure. We just need someone to manage and coordinate it all. We hope to see hospitals and the community working together in partnership. And the community will then be suitable for the elderly to live in and to receive the care needed. I also agree that Chinese medicine plays a very important role in primary health care. Many people like to visit Chinese doctors, so I hope that in future the government will encourage more people to go for Chinese medicine services as well, and to provide a guideline for practitioners so that we'll be able to work better in partnership as well. I hope that in future our community can be suitable for the elderly to live in, and that we'll all be able to enjoy primary health care.
Mr. Tommy Chiu, Madam Deputy, I support Ms. Eunice Yong's motion, and I'd like to explain my amendment. My amendment seeks to include the importation of non-locally trained doctors and frontline healthcare workers to alleviate the shortage of manpower. And we need to remember that the healthcare system comprises both hardware and software. At the previous time of electrical, we passed the Medical Practitioners Amendment Bill 2021 to offer exemption of the licensing examination. But if we open the floodgates, even if we open the floodgates, I'm not sure whether this would be the solution, because in recent years only a few dozen doctors came to Hong Kong, and we are concerned that manpower will still be lacking. That's why last year the Liberal Party proposed relaxation to allow non-locally trained doctors who practice in Hong Kong. Unfortunately, it wasn't passed. The Liberal Party believe that overseas trained doctors without a spouse who is a Hong Kong permanent resident can be registered in Hong Kong through a special route. And many manpower programs in Hong Kong would consider the background and occupation of the applicants. And currently, the government is drafting a list of 100 recognized medical schools. The Liberal Party recommended that the scope should be expanded to those who work in or under these recognized medical schools. For students graduated from the Stanford Medical School, they could be registered in Hong Kong through this special pathway. But for those who did not graduate there but are currently working at Stanford, they are not allowed to practice in Hong Kong. If a doctor is capable of teaching at the Stanford Medical School or work in the hospital, then their professional expertise should be recognized. That is why the Liberal Party recommended that these doctors should be allowed to practice in Hong Kong through this special pathway. The government can retain control in the scheme and be able to decide if they need to stop the importation at some point. And that was the case in Singapore. The government invested dozens of billions of dollars in healthcare every year. In the next 3 years, a lot of funding is reserved for new hospitals. For the North Lantau Hospital, 5 years after opening, it was criticized by the audit of underutilization. The HA pointed out that by 2030, we will lack 500 to 600 doctors. I never agreed with such data. I think that the real shortfall is 5,000 to 6,000. From 1990 to 95, 200 foreign doctors were introduced, making up 42% of the new recruits at that time. For private hospitals, they did not have much business since people generally preferred public hospitals. But since the Medical Practitioners Amendment Bill or Medical Registration Amendment Bill, subsequently 455 non-locally trained doctors practice in Hong Kong, making up 3% of the number of new doctors in 2018. So you could see how much the supply has fallen. Some members asked whether pay for doctors should be reinforced, but the fact is, even if you raise doctor salaries by 5 times, they would still quit public healthcare. I hope members would support my amendment. Mr. Duncan CHIU. Madam Deputy, I declare that I'm a member of the Hospital Authority. as well as the chairman of the HA Committee on IT Services. I totally support Ms. Rebecca Chan's motion on 10-year plan for primary healthcare and the idea to raise public awareness on health. According to recent surveys, in the next 10 to 15 years, public healthcare would be put under great stress. We are losing medical professionals, the population is aging, and chronic illnesses are getting younger and younger, and that could lead to a collapse in our public healthcare system. Despite government efforts to introduce more doctors, including the medical registration bill, which was passed last year, we still face a huge gap. Apart from promoting prevention-based healthcare, properly using technology is essential. In the past, the government lacked holistic planning in healthcare planning, and in using innovation and technology, the outcome was not satisfactory. For the electronic health record system, there was no policy support to allow private providers to upload the data. As for the telemedicine pilot schemes, there was no legislative support, and all these measures failed to achieve their goals. So in establishing a long-term, long-term electronic healthcare policy should be introduced. The National Health Commission published the Comprehensive Digital Healthcare Plan in 2018, including internet treatment plans, electronic patient record system, assessment systems, etc. These cover the areas of legislation, licensing, regulation, the data security, manpower management, etc. And the SAR government can learn from these pilot programs. In terms of telemedicine services, the mainland has defined the types of illnesses where telemedicine could be applied, the age threshold in which patients must be accompanied by adults, the types of drugs that shall apply, and specific logistics operators who can deliver drugs. And the mainland has started to see results thanks to the healthcare plan. In some hospitals, waiting time for some specialties went down by as much as 2/3. In mid-2010, Singapore has been promoting telemedicine, and they encourage both healthcare providers and patients to take part, and we are lagging behind in this regard. So the purpose of my motion is to urge the government to make better use of technology, and a digital healthcare policy must be incorporated in any future plans in order to tackle our healthcare issues and improve the quality of healthcare services. Thank you. Ms. Judy Chen. Madam Deputy, Hong Kong faces rapid population aging, and public demand on healthcare would only continue to go up. In order to refine our public healthcare system, it's important to improve people's health and enhance community collaboration. Long-term planning on primary healthcare is needed. That is why I support Ms. Rebecca Chan's motion. Madam Deputy, Hong Kong's public healthcare system has always been under tremendous stress due to a serious imbalance in supply and demand, the lack of beds, and shortage of manpower. And as such, the supply and demand are at an imbalance, and the waiting time for many specialties is very long. That is why many patients have missed the golden window for treatment. And very often they had to be hospitalized as a result. And many healthcare professionals are under stress, and this affects the quality of public healthcare services, and we are looking at a vicious cycle. Hong Kong's primary healthcare has been lagging behind. District health centers have been using a piecemeal approach in attending to elderly patients, and they did not impart health awareness among the elderly, and they did not follow up on the living habits of the elderly. At the end of the day, that points to a lack of efforts in promoting prevention. Prevention is always better than cure. And this is what primary healthcare is all about. It plays a key role in safeguarding public health. Prevention is the focus, and district centers would be the staple of the work. If the government can improve primary healthcare in Hong Kong and to facilitate cross-disciplinary healthcare development, providing health screening and assessments by making use of community resources, the healthcare capabilities on a community level could be reinforced. And if that is successful, demand for medical services would be greatly reduced. In the last policy address of Mr. C.Y. LEUNG, he talked about enhancing the roles of primary healthcare in our healthcare system. I hope the government will continue to explore the issue and to allow members of the public to receive occupational therapy or physiotherapy services without a referral letter. Let me give an example. Let's say if I suffer a muscle tear one day, I would have to limp my way to a registered physiotherapist, only to be told that he cannot attend to my case because I cannot show a referral letter. So I have no choice but to turn to a public hospital, but I might have to wait 100 weeks. And perhaps a few months later, they would arrange physiotherapy sessions for me. So I have a few options. That is to go to an unregistered physiotherapist or go to the A&E ward. So again, we are looking at a vicious cycle. If every district can provide primary healthcare services, including professional diagnosis and patients who require physiotherapy sessions can receive the service without a referral letter, so primary healthcare is the first point of call for the public, and the government should provide comprehensive support, and that is how we can build a prevention focused framework. I hope members would support my amendment. Thank you.
Monsieur Nezion. I'd like to thank Ms. Chen Hoi-yan for moving the motion on 10-year plan for primary health care. I'm in full support of this motion. I would like to talk about why we need a 10-year plan. Well, have a plan means that we have an objective. We want to resolve the deep-rooted problem. The problem here is a very long waiting time for primary health care. A 10-year plan for primary health care will be able to reduce the waiting time for specialist services. And that will, of course, be good news to members of the public. Well, it is not anything new that the public healthcare system is under huge pressure. You may have to wait for over 100 weeks for specialist outpatient services, and during the pandemic, it has become even more severe. With the pandemic in the past 2 years, we have seen an escalating problem. Many people have given recommendation, and I think that working with Chinese medicine practitioners would be very effective. Therefore, in my amendment, I have suggested enhancing community Chinese medicine services, the promotion of Chinese medicine, and that it should also be included in the district health centers. And so through the partnership between Chinese and Western medicine to alleviate the pressure on the public healthcare system. I also agree with what Dr. David Lam said, to have professionals at the district health centers to coordinate the services. I see that there is many public-private partnership in Chinese medicine right now, but I hope we'll be able to extend the scope so that more members of the public can also join in such services. Currently, Chinese medicine is still not incorporated into the public health care, but there already is a very high number of Chinese medicine practitioners. Therefore, if people could seek the help of Chinese medicine practitioners, it will also alleviate the pressure, and that will be much faster than waiting for Western medicine practitioners. Therefore, I did suggest in my amendment to also include Chinese medicine in the scope of services of health centers and health center expresses. I also hope to enhance the promotion of Chinese medicine so that people are more familiar and would choose to adopt Chinese medicine. I very support the government in establishing the first Chinese Medicine Institute in 2025. A provision of 400 hospital beds will be able to provide service to over 310,000 patients at one time. Chinese medicine practitioners believe that this pace is still quite slow. Therefore, if we're able to extend the scope of services of Chinese medicine in district health centers, would also be effective in resolving the issue at the prevention level. Therefore, however, we cannot only rely on hospitals and Chinese medicine practitioners. We really must try to adjust Chinese medicine practitioners' salary as well, because it is on the low level. So starting Chinese medicine practitioners only receive about $20,000 as basic salary. However, for nurses under public hospitals, the basic salary is already $20,000 to $30,000, and for doctors, it's about $50,000 to $60,000. So the government should also allow Chinese medicine practitioners to enjoy the same salary scale as Western doctors, and to encourage more people to join the industry. Chinese medicine goes under hospital authority. Therefore, it's actually Western medicine governing Chinese medicine. Chinese medicine and Western medicine work in different systems, and we believe that Chinese medicine should be managed under Chinese medicine practitioners. Chinese medicine development has been surging in recent years, and we hope and that we'll be able to review our medicines in a more expeditious manner. I hope members will support my motion.
Secretary for Food and Health. Madam Deputy, first of all, I would like to thank Ms. Hoi-yan for moving the motion on 10-year plan for primary healthcare, and to other members who have proposed amendments. This allows us the opportunity to discuss the development of primary healthcare. All along, it's close to my heart that we promote the development of primary health care. Is also an important healthcare policy of this term of government. Hong Kong has a well-established a dual healthcare system that puts the focus on both the public and private sectors. The public healthcare system provides a safety network for our healthcare system so that no one would be denied medical services because of lack of means. As for those who could afford to pay the reference fees, the private sector will provide personalized choices to them. Now, we are seeing increasing number of chronic diseases, and also we have an aging population. So the public healthcare system is facing immense challenge. There are about 2 million people in Hong Kong who have one or more chronic diseases. Most of the patients receive follow-up treatment at public hospitals. In particular, the specialist outpatient clinic takes up a heavy caseload. These clinics provide some 7.5 million consultations in a year, and we're seeing an increasing number of new cases, so you can imagine the pressure. And now we're seeing an aging population and more increasing trend of chronic diseases. So we need to adopt a multi-pronged approach to cope with the increasing healthcare demands. At the same time, we need to alleviate the pressure on the public healthcare system. One of the important aspect is to shift the emphasis of the present healthcare system and people's mindset from treatment-oriented to prevention-focused, as some members pointed out. So we need to use that as the basis for building a sound and robust primary healthcare system. Primary healthcare is the first contact point for continuous medical care for individuals and house and families. And also it provides comprehensive, continuous and convenient services at the community level, and it's people-based. And so a primary healthcare system is supposed to be the gatekeeper in supporting the development of, in the long run, of the secondary and tertiary tier of a healthcare system and hospitals. Now, Ms. Chen and other members have pointed out the importance of the primary healthcare system, and this is a very top priority for this term of government. It is a long-term task, of course, to reform the healthcare system, and so we have started planning for a comprehensive review of primary healthcare services and governance structure. We want to prepare a blueprint. The blueprint will be more than a 10-year plan. Rather, we will have structural reform with future policy directions, and this could see us through decades of challenges. Of course, we will be providing a roadmap and timetable for the reform. Our vision is to improve the health of the community as a whole. We want to improve the standard quality of living of the public. At the same time, we want to provide a primary healthcare system that will provide medical protection to every citizen. Now, with strengthening primary healthcare service, we could enhance preventive care, reduce the need of hospitalization, and then also at the same time we could promote public health. So this, in the long run, it will help us to control the escalating expenditure on healthcare. So we have a steering committee on primary healthcare development. And under the leadership, we have started our discussion on the reform for the healthcare system. And we would wish to achieve the following objectives. First, to prevent chronic diseases, in particular diabetes and hypertension. Two, to allow early identification of chronic diseases and suitable treatment for these patients through a community-based primary healthcare system. 3, for those diagnosed with chronic diseases, we hope there will be early detection and management of related complications of these diseases. This will reduce the chance of hospitalization for the chronic patients due to complications. Now, the public healthcare, primary healthcare services have been provided by the Department of Health, the Hospital Authority, and the private family doctors in private practice. This has been the practice. But now we want to change the shift the focus, as we mentioned. So we want to promote community-based primary healthcare services. In the 18 districts, we're going to set up district health centers. That is an important first step to change our healthcare system. In Kwai Ching and Sam Shui Po, the DHCs were opened in 2019 and 2021. As for Wong Tai Sin, Tuen Mun, Southern District, Yuen Long, and Tsuen Wan District, the DHCs in these districts will be commissioned soon within this year. we want to keep up with the momentum of in improving primary healthcare services. So for districts where we cannot set up the DHCs in time, we have set up DHC expresses, and these centers, these expresses have started working since 2020. End of 2020, and we have so far 11 DHC expresses. Now, the community-based, the DHCs will provide disease prevention services on 3 levels. The primary level is to promote health education and focus on changing habits and raising public awareness on personal health management through various channels. This in that way there will be prevention of diseases. The secondary tier is about early identification of those with high health risks, and also through health risk assessment. And then if necessary, cases could be identified early, and they could be referred to family doctors in the network for further screening and medical tests. And then we can confirm if these patients have indeed contracted the diabetes or hypertension. The tertiary level is to provide chronic disease management for patients with stroke, hypertension, diabetes, musculoskeletal diseases, hip fracture, and also acute myocardial infection. There will be a rehabilitation program. So the aim is to prevent them having to go into hospital again. There will be multidisciplinary professional teams, including that provides medical services, medical tests, nurse care consultation, and also various allied services such as physiotherapy, occupational therapy, diet, consultation, speech therapy, and so on. There will also be actually Chinese medicine service. Now, in fact, about 70% of the primary health care is now provided by the private sector, so there is an even distribution of services. And because the treatment protocol is unclear, so people switch from doctor to doctors often. And about 20% of the public have their own family doctors. And that's a small percentage, so we're not able to make the most use of family doctors to provide triage, to achieve triage and community synergy. Now, these are the constraints that prevent the private sector from taking part in the provision of healthcare services. And also, this adds to the pressure to the second and tertiary tier of healthcare services in the public sector. We believe there is need to have a comprehensive coordination of primary healthcare services in all sectors. This will help us to achieve a better balance, and then it will reduce the necessary use of hospital services. The government is committed to promoting individual and community participation, coordination, and the coordination of different sectors, so that we could strengthen district-based primary healthcare services. And we could also encourage the public to prevent diseases, and also take better care of themselves and reduce the need for hospital services. So we'll be adopting a series of measures in this respect. Firstly, we're going to build and revamp primary healthcare system that is community-based and prevention-focused. Now, apart from rolling out district health centers in the 18 districts, we're also exploring the integration of and the development of primary healthcare services that are community-based. And DHCs and DHC expresses are being commissioned in the 18 districts. So we are the hardware network of our primary healthcare system is slowly taking shape. We hope that we will build primary healthcare service hub, so that with public partnership and other service models, we could link up other partners in community services. That includes public healthcare services, private healthcare services, community care and support services, and even social services. that will help us to integrate the various primary healthcare services, including disease prevention and management, community rehabilitation, and support for carers, and so on. And then we could adopt a flexible approach in promoting the primary healthcare services that are needed by the relevant communities. So this is a bottom-up approach in strengthening cooperation between the medical and the social sector. The second is to strengthen public health care services and making the most of primary health care services, as some members have suggested. So we could make such adjustment, and so we could achieve a better balance, and then we'll have regard to the needs of the public. We will support the development of quality private healthcare services to complement the services provided by the public sector. This will provide more choices to the public. And also in the primary health care blueprint, we will explore the positioning of public healthcare services, in particular those of the Department of Health, the Hospital Authority, DHCs, and private sectors. We want to avoid duplication of public resources. At the same time, we want to make the most of primary healthcare resources in the private sector, that we could provide more efficient and more effective services that meet the needs of the public. In fact, in the past few years, we have launched a series of measures as follows. One, the Hospital Authority has measures to manage the waiting time for public healthcare services. Now, to cope with increasing demands, the Hospital Authority has implemented a series of measures to manage waiting time. Many members just now mentioned a challenge in this respect. And also, they will be promoting more public-private partnership schemes, and also will be introducing Chinese medicine outpatient services. The Hospital Authority will review the effectiveness of these measures from time to time and see if there is need to enhance any measures. This will help to improve the waiting time for specialist outpatient clinic. The Hospital Authority will also be launching schemes across clusters to cover most specialist disciplines. Now, as I mentioned, the purpose of public healthcare services is to provide a safety net for the public. So we want to make sure that no one is denied medical services due to lack of means. So in the blueprint, we will review the feasibility of introducing more private sector services in the management of chronic diseases. In particular, we will review the primary care services in the public sector, especially the positioning of a general outpatient clinic, so that we want to make sure resources are put to optimal use. As members would agree, we're facing an aging population, and there is an increase in chronic disease in chronic patients. So we're under immense pressure, and with limited resources, we need to consider how we could focus our resources on the public sector to provide the necessary and continuous primary healthcare services for the low-income groups and the disadvantaged, including the elderly and the chronic patients. Otherwise, then for those who have a genuine need for public healthcare services will not be able to get the necessary services with the unduly long waiting time. And also, they won't get timely treatment and care, and if they cannot afford private services. Now, some members mentioned public-private partnership schemes. Now, the public healthcare system in Hong Kong is has high cost benefit, but then it's heavily subsidized by public funds, and then there's there's excessive demand. So sometimes there is imbalance between the public and private sector, and there's no sustainability. So that's why we need to make sure that we put resources where is needed by the public. And so the Hospital Authority has been promoting various clinical PPPs to provide more choices to the patients. For example, we have PPPs for hypertension patients and diabetes patients. For those who are in stable condition with these diseases, they could choose to switch to private sector primary healthcare services from general outpatient clinic services. And to support the government's policy of promoting private primary health care, the hospital authority has introduced the co-care service model at the end of 2021. So for those in stable conditions who are now going to the specialist outpatient clinics, they could choose to go to the private clinics which have joined the PPP scheme. The co-care service model started its pilot scheme in the third quarter of 21 with a general medicine ward, and it will be promoted to the orthopedic ward in the fourth quarter. Now we want to support the screening and management of chronic diseases. The Chief Executive announced in the policy address that we want to relieve the pressure on the public healthcare system. We want to promote the concept of family doctors. So at the Sham Shui Po DHC, we have launched the PPP pilot scheme for patients who've been diagnosed with diabetes or hypertension. There is a network of doctors, and they could receive subsidy from the government to provide consultation services and allied health services. This will help to help patients to better manage their own disease and reduce the need for hospital services. The government is committed to making the most of private healthcare sector's resources to relieve the pressure on the public healthcare system. Now, the PPP does not aim to contract out public sector services to the private sector, but rather we want to provide choices to the public who could afford to pay certain fees. This will help to promote PPP and achieve better care result for patients with by making good use of the available resources. So the blueprint will explore further cooperation between the public and private sector. We could identify suitable private sector services to support chronic patients and relieve the pressure on hospital services and the specialist services. And also, as the next step, we have to consider how we could include private healthcare services into our healthcare planning and development, so that we could have a more systematic approach in supervising and regulating services provided by the private sector. So in the blueprint, we will explore upgrading the primary care directory and the reference framework system for care in primary care settings to ensure the quality of services provided in the directory. Then there will be conditions spelled out. For example, one requirement will be for them to engage in continuous professional development. And also we will require all service providers to be registered as private service providers under the directory. And then they must follow the reference framework formulated by the Bureau on the management of various chronic diseases. This will help us to provide standards for the provision of service, and then they could play a better role as the gatekeeper in the secondary tier of healthcare. And also, we will have a two-way referral system. So for patients with acute needs, they could be referred to specialist outpatient services more quickly. As for those in stable condition, they could continue to receive primary health care service. This will achieve the triage effect. Now, since 2009, the government introduced the elderly healthcare voucher scheme for those who eligible elderly aged 65 or above. They are given $2,000 of healthcare voucher each year, so they could choose the private primary healthcare service that best suit their needs. The scheme plans to, the scheme aims to enhance primary healthcare service for the elderly, to provide them with additional services, and then so they could acquire the services they need. Now we want this scheme to better support the development of primary healthcare in Hong Kong. So since 2019, the Department of Health has introduced various measures to enhance the scheme. That includes the use of the vouchers at DHCs, and also we have enhanced education for the elderly to better use and plan the use of the healthcare vouchers, and also we have stepped up screening and supervision of the use of healthcare vouchers. We also limit the amount of voucher that could be used in individual clinics to prevent over-concentration of use of the vouchers. And then the vouchers are meant to support the medical needs of the elderly. It's meant to help them learn how to prevent disease and better manage their own health. So this works well with development of DHCs. On this basis, we want to make sure healthcare vouchers are put to good use. We have to consider the impact on public finances. At the same time, we want to make sure the scheme will effectively promote primary health care. So we will continue to review the operation of the scheme and make necessary and timely adjustments. We do not rule out the possibility of further regulation of the use of healthcare vouchers under the primary healthcare development framework, blueprint framework. So, for example, we may designate certain uses, such as for the purpose of health risk assessment, management of chronic diseases, and screening. And also, we may require the registration of primary healthcare doctors as family doctors. And then for family doctors, there may be designated use for the vouchers. At the same time, we will introduce the concept of co-payment. So this will help the elderly to make good use of their vouchers for the prevention of disease. On manpower, many members mentioned that too. Of course, we need to step up our training and planning of manpower. So we need to have an effective primary healthcare system in Hong Kong. That means we will need continuous supply of manpower in the primary healthcare sector. To do so, at the same time, we need to provide primary healthcare services in the community by multidisciplinary teams. These teams must have sufficient knowledge of primary healthcare to ensure the quality of service. Now, with an aging population, we need to step up training of primary healthcare manpower. We need to enhance the functions and duties, and we need to make sure there is a sustainable supply of such manpower. Now, we want to make sure there are qualified healthcare professionals to support the continuous development of our healthcare system. In 2017, June, we published the report of the Strategic Review on Healthcare Manpower Planning and Professional Development. Some members refer to that. Now, 10 recommendations were made in the report, and that forms the basis for the manpower planning in Hong Kong. And also, for the professional development and regulation of healthcare personnel, the future direction has been set in this report. Now, to support the triennial planning of the University Grants Committee, the government will update the manpower projection on a 3-year rolling basis. The latest round of updating has been completed, and we announced the results at the end of March 2021. Now, the government will work with various committees to further explore introducing non-locally trained medical personnel to Hong Kong. For Chinese medicine, some members pointed out that this is a very important discipline, and it's also an important part of our healthcare system. Now, the government has already affirmed the status of Chinese medicine as an important part of our healthcare system. So it plays an important role also in primary healthcare. It could work together with other healthcare disciplines to protect the health of the public. In fact, the government is committed to promoting the development of Chinese medicine. In the 2018 policy address, the positioning of Chinese medicine in our healthcare system has been affirmed. Now, the government is subsidizing specified Chinese medicine services, and Chinese medicine is introduced into our healthcare system. One, there will be a future Chinese medicine hospital that will provide government's subsidized hospital and outpatient services. Two, at the 18 there will be Chinese medicine clinics come training and research centers in the 18 districts in Hong Kong to provide government-subsidized outpatient services. 3, the hospital authority will provide integrated Chinese Western medicine services in designated public hospitals. So these 3 measures will complement the healthcare system. Now, at existing HCs, they may also buy Chinese medicine services. Chinese medicine practitioners could provide acupuncture and acupressure services to patients with stroke, back pain, or knee pain. And also, Chinese medicine practitioners could provide education on disease prevention, health preservation, and so on. And also they could provide, they could conduct classes on diet therapy. In fact, in one DHC, there's collaboration with Chinese medicine clinic to provide moxibustion therapy. And then for other allied services, there will be subdiscipline directory. So we'll be compiling various primary care directories for different disciplines to promote the development of primary healthcare services. And as we formulate the blueprint, we will explore the need for manpower and how they could. We could also consider how Chinese medicine could play a stronger role, and so on. We'll be strengthening various training as well for these various disciplines. Madam Deputy, as I mentioned earlier, the government will be publishing the blueprint on the sustainable development of primary healthcare services in Hong Kong within this term of the government. We hope to provide a comprehensive primary healthcare network that would promote public health and enhance the quality of living of the public. The blueprint will cover 5 aspects apart from future development. That is integrating services, strengthening supervision, improving the use of resources, and increasing manpower planning and training, and also strengthening the sharing of medical records and data. Now, I will listen very carefully to the views of members, and I will give a further response. So I speak.
Dr. Low Wai Kwok. Madam Deputy, first, I'm grateful to Ms. Chen Hoi-yan for her original motion and 7 members who have moved amendments. The purpose of the motion is to urge the Hong Kong SL government to be more prevention-focused in carrying out a 10-year plan for primary health care. Myself and DPP are in support of the motion. I am always very concerned about healthcare issues in Hong Kong. For the past 6 years, I've been a member of the HA board, and I only stepped down in 2021. So I understand the tremendous pressure faced by our public healthcare system. People have to wait for years to see a specialist, and then there aren't enough beds in the medicine specialty in public hospitals. While the government has injected a lot of resources into the system, we don't have enough supply to meet public demand. Madam Deputy, things have to change, but I'm afraid we do not have a one-size-fit-all solution. We have to adopt short, medium, and long-term measures to tackle the problem. The government should refine the current resource deployment process. We should use technology to digitalize the treatment processes so that patients can have access to more expeditious and better medical services. The government should further encourage public-private sector participation, including a partnership in a specialist outpatient, so as to alleviate the pressure on the public hospitals. And as for manpower shortage, in October last year, we endorsed the Medical Practitioner Registration Amendment Bill 2021, so that non-locally trained doctors, so long as they fulfill certain conditions, they can practice in Hong Kong after registration. The amendment will allow us to import non-locally trained doctors more expeditiously to alleviate the pressure on our frontline doctors. Madam Deputy, as the community ages, there will be an increasing demand on public healthcare services, and therefore, in the medium and long term, we must enhance our software and hardware in healthcare system. The government is spending $200 billion on the first 10-year hospital development plan, and another $270 billion will be put in the second 10-year hospital development plan. Now, to dovetail these measures, the government should project the future demand for healthcare personnel and upgrade our training facilities, and should consider building the third local medical school. Madam Deputy, prevention is always better than cure. In order to effectively ameliorate the pressure on our public healthcare system, we must tackle the problem at source. In the long term, the government should set a blueprint for primary healthcare promotion. There should be health indicators set up to enhance people's pursuit of healthy lifestyle. And then in 2016, the country promulgated a framework on healthcare, and primary healthcare is the emphasis, and there should be innovation and technology. Prevention is as important as cure, and Western and Chinese medicine should be given equal emphasis. People should be encouraged to lead a healthy lifestyle, and various indicators should be set up, including the average life expectancy, as well as the health literacy, and also the number of doctors per 1,000 population. And there should be better establishment of an infrastructure of healthcare structure and data. So there should be smart medicine and prevention, rehabilitation, treatment, and there should be self-management of the country's data on healthcare. We have to ensure healthcare, primary healthcare. We should reorganize the resources deployment. We should improve our district network, and DHCs should be set up in all 18 districts. We must promote the application of Chinese medicine so that we can leverage on the advantage of Chinese medicine. It will help to make people healthy. Thank you. Ms. Nexi Lam. Madam Deputy, I support this motion on 10-year plan for primary health care. For 7 years in a row, we have the longest expectancy in the world. The average life expectancy for men is 84.65, and for female 89.6. We are doing much better than many advanced economies. However, I'm afraid our healthcare infrastructure has not caught up with the need. Now, the longest waiting time in Hong Kong is for joint replacement. People have to wait for up to 5 to 7 years before it is their turn. Many elderly persons have been forced to greatly restrict their social life. If they have pain, they dare not go out. They will not socialize with friends and family members. At one time, an elderly person told me that he felt worthless. He would rather die sooner. I think that this is totally unacceptable. Many residents in Hong Kong, well, because they have to wait for a long time to see a doctor, they'd rather not to see any. So a minor illness can become a serious one. This has greatly added to the pressure to our healthcare system. Now we should promote Western and Chinese medicine partnership to prevent serious diseases, and we should have triage services. These are easy to implement and flexible. Now, if in the long term we can develop primary healthcare centers in the community, then people can have easy access to doctors, and they will only go to hospital when their illness is serious. No one would like to see our elderly persons having to wait for 3, 5, 7 years before they can have follow-up consultation. We don't want our employees in Hong Kong to refrain from taking leave in order to see a doctor. Now, in the long term, we must boost public-private sector partnership so that we can have better triage services, so that we can really do service to our population.
Mr. Chen Ying, Madam Deputy, as Ms. Nixie Lam pointed out, our life expectancy has always been among the top around the world, but then different experts will have different interpretation of those figures. But then the general public believe it's not because we have a good air quality or good natural environment, and it's also not because of our diet and so on, but rather it's because we have public health care system that's the envy of many, because the government's invested much into that. But then with an aging population and also an increase in chronic diseases, and then private care is also becoming more and more expensive to cater to the rich only. So we are seeing increasing problems, and then there is a continuous shortage of manpower, and public hospitals are really crowded, both at the accident and emergency wards and in the different medical wards. So we are at a breaking point. And this is going to be an increasing problem. There will also be heavier and heavier financial burden. I'm grateful to Ms. Chen Hoi-yan for moving this motion on primary health care. I also thank the 7 members who moving amendments. They point out the problems that the public health care system now faces. They also have proposed various measures to relieve the pressure. I support the various measures mentioned in the original motion and the amendments. On primary health care, some suggested that government should consider opening up the market at the same time, so that for medical staff of different personnel of different disciplines could fully realize their potential. How could we integrate public services and private services, and how do we coordinate the division of work between the public and private sectors? And then for district health centers and so on, how could we enhance public understanding and trust in these centers? So these are urgent issues that we need to study and address. But then in the past 2 years, of course, we've been through we are going through the COVID-19 pandemic. That shows that whenever there's a pandemic, then there are serious shortcomings in the traditional healthcare systems. While we keep investing in traditional healthcare systems, the government should also start studying the deployment of various modern-day technologies. Now, we visited Hangzhou before. We visited a group that provides one-stop medical service platform. That group provides online consultation, online prescription, and online purchase of medication. And now there is also online Chinese medicine service that provides online consultation, prescription, and so on. So what is the conclusion of that study? In the report, we say that with an aging population and increasing demand for healthcare services, the government should find ways to lessen the workload on medical personnel by making use of technology. In fact, this could become an important part of the new healthcare infrastructure. Instead, we could go from physical consultation to online consultation, and we could build a big database, and then through online electronic management, screening, and other management of clinics and so on, we could we expand the scope of service, and then we could also have one-stop supervision service. Now, with artificial intelligence and digitalization, I believe we could lessen the workload of healthcare personnel. We could also relieve address the shortfall of medical doctors. So smart medical service is definitely the way forward. Now, of course, to promote this development, we need to plow in resources. And the government should explore how we could integrate government and private capital, and then we could have a win-win situation. For example, the government could provide land, and then businesses could be responsible for building and management of facilities. That may be a better model for collaboration. Now, in communities where the public live and work, the government should provide people-based and convenient and affordable healthcare services. This is to promote public health. I don't think the government should just be tinkering here and there, but rather it should come up with a long-term strategy. There should be long-term goals for prevention and surveillance, and then we could achieve the intended objective. Thank you. Mr. Kwok Wai Keung. Thank you, Madam Deputy. Of course, we should tackle, ensure there's early treatment of diseases. But only those who could afford could seek treatment. And if for those who don't have the means, they don't get treatment, that is not fair. Now, the general public are all working so hard and they're trying to make ends meet. And then many could not really afford private health care, so they have to queue up for public health care services, and the waiting time is in terms of years. So the minor ailment may have become a serious illness. In 2020 to 21, the average waiting time for new medicine services is 68 weeks, and then for ear, throat service is 60 weeks, and then for obstetric service is 41 weeks. So we're talking about a wait of almost a year on average. So how can we ensure early treatment of diseases? Now, the FT has always asked for enhancing primary healthcare service and shorten waiting time for medical services. There has to be specific objectives and strategy so that people are given appropriate treatment in a timely manner. This will help to actually reduce the time for people to recover. Now, I'm the Deputy Chairman of Hepatitis B Association. So I would use hepatitis B as an example. It's estimated there are about 560,000 hepatitis B patients, and some 540,000 of them are carriers of hepatitis B. And 1 in 4 of such hepatitis B patients may eventually develop lung cancer or liver cancer. Liver cancer is, of course, among the first 3 cancer killers diseases. That's why in 2018, the government set up an office to control hepatitis disease. And then it's also formulated an action plan on controlling hepatitis disease. Because WHO has set a target of eradicating hepatitis by 2030. So the action plan is to achieve that target. Of course, it's a good start, but then the office faced many obstacles, so it's not easy to achieve that target. 90% of the patients first have to be diagnosed that they actually have the disease. There's a Hong Kong U study some time ago. Only about half of the patients actually know they have contracted the disease. The other half know nothing about it. So, and other conditions, another target is for 80% of the hepatitis patients to get treatment. And then we want to reduce hepatitis B and C cases by 90%. We want to reduce the fatality rate by 65%. But it's very difficult to achieve all these targets because, as I mentioned, there are many challenges. First of all, many people don't even know they are carrier of the disease or they've actually contracted the disease. And there are many many have not been vaccinated. Because it's only since 1988 that there is vaccination for newborns. For those born before 1988, they wouldn't know whether they carry the disease or they have not been vaccinated. And the third challenge is that the disease is usually passed on by mothers to babies. And if mothers are carriers, it's possible that infants may not actually have the disease. It could still be healthy, but that's a challenge. A fourth challenge is that there is need for regular checks because there could be changing condition for the disease. That's why there's need to have regular follow-up. And then a fifth challenge is discrimination against the disease. People don't know the disease, so some patients may choose to ignore they have the disease. So I'd like to make a suggestion. I hope there will be territory-wide, community-wide screening. There's no need to have lockdowns to screen hepatitis. And then we must also encourage people to get vaccinated. And then thirdly, we have to enhance public awareness and education. And fourthly, we must give support to patients to follow up regularly on the disease. There's need for them to do ultrasound screening, for instance. So it's all about money. I hope the Revenue Department will take targeted measures as early as possible. It's hoped that by 2030, Hong Kong will be able to achieve the target of WHO to eradicate hepatitis. Thank you. Mr. Chen Kim-po. Thank you, Madam Deputy. In Hong Kong, we've always have a good and cheap services, but then there are increasing demand, so there's heavy pressure on the public healthcare system. In fact, people often prefer to have public healthcare system, so we're seeing now long queues for specialist services, overcrowdedness in accident and emergency ward, and with an aging population, of course, we're seeing demands increasing exponentially. So we need to do something. The government is taking measures, for example, bringing in overseas doctors, introducing voluntary health insurance scheme, and so on. But then all these reform measures don't really tackle the root of the problem. So we are not able to deal with the problems brought about by the aging population. That's why I'm grateful to Ms. Chen Hoi-yan for moving this motion. I think we need to address the problem at source. That is, we need to reduce the need for healthcare services. In other words, we want to reduce the chance of people contracting disease. So prevention must go before treatment. That's why I'm all for this principle of prevention-focused rather than treatment-oriented approach. Now, when people are in their 50s, 60s, they would have various diseases because their living style is not heavy, they don't exercise, they eat junk food, they go to bed late. Now, people have to stay healthy for them to be happy and for the community to be in harmony. Last year, I had suggested the government introduce various measures. For example, we should educate the public to take care of their health and also give them knowledge on how to preserve their health. We can encourage the public to take up sports. And of course, in promoting healthy lifestyle, it will help to prevent the chance of contracting disease, and then also people could become healthier and they will live happier, and definitely that will reduce the healthcare expenditure. Okay, so it achieves many purposes. Now, how do we do that? We should start with schools. Schools encourage students to do exercise, but then there's no focus on healthy diet. I think the schools should teach students about healthy eating. For example, they should tell students about the harm of high sugar drinks and so on. Now, food, of course, a diet, of course, very important on health. So if we give the right information to students at a young age, they will benefit for life. Now, many students are eating junk food a lot, so there is there's obesity problem, and then by the middle age they will have various diseases. So it's important that we promote healthy eating, and also we should enhance public awareness about healthy living. Now, during the pandemic, people wearing masks, they're washing their hands frequently, they take, they pay attention to personal hygiene, and we're seeing actually far fewer infectious disease cases. So we need to keep a healthy living habit, and then we could avoid, prevent many diseases. And at the same time, we need to strengthen training for family doctors and specialist doctors. So family doctors play an important role in preventing disease. The government could use subsidy to encourage the public to go to their family doctors regularly for basic screening and checking. And then diseases could be identified early. At the same time, family doctors are familiar with the patients, so they could offer useful advice to prevent disease. Now, in one of the amendments, it suggested that there should be strengthening of a private-public sector partnership to relieve the pressure on the public sector. I support that. Now, the government introduced a voluntary health insurance scheme, but then eventually the government substantially cut its subsidy amount, so that there is now less coverage for the high-risk groups. But then this scheme's also succeeded in attracting many middle-aged people to join the scheme, so it's successful in a way. I think the government should expand the scope of the scheme. So it could say, for example, it could provide more tax allowance and also give better coverage to the high-risk groups. so people who could afford it could then make better use of the private sector services, and the public services could then be reserved for those with needs. So the scheme could then attract people who could afford to join it, and we could really achieve triage in that way.
Mr. Chen Hong, thank you, Madam Deputy. Madam Deputy, I first thank Ms. Rebecca Chen for moving the original motion and the 7 members for amending the motion. This gives us an opportunity to discuss primary health care. I support the original motion, especially better utilizing the Chinese medicine practitioners. I agree with Mr. Edward Leung, Ms. Judy Chen, and Ms. Leung that Chinese medicine should be incorporated into the primary healthcare system, and we should develop Western Chinese medicine collaboration. The Chinese medicine focuses on curing the illness while it is still obscure. It is very beneficial for prevention and rehabilitation. I support providing Chinese medicine outpatient services in the 18 districts. Every clinic should be equipped to provide Chinese medicine services to the people. Currently, many people are paying out of their own pockets for Chinese medicine services. The government should incorporate Chinese medicine into primary health care so as to promote the adoption of Chinese medicine. Ms. Young mentioned that we used to manage Chinese medicine practitioners under a Western model. We have to invite mainland talents to run our Chinese medicine healthcare system. And also, we because of the dire need for dental services, we have to reform the dental healthcare system to provide dental healthcare services for students. I agree with Mr. Duncan Chiu's amendment that we have to set out a strategy for digitalization of medical healthcare services. Big data technology is very important for promoting the transformation of medical healthcare. For elderly people, they are not very tech savvy. On my mobile phone, I have an e-health app, HA Go from the HA, I Am Smart, and so on. We need a one-stop platform. With one click, you can have access to all services. That's important. Secondly, we have to hold the livelihood issue close to our heart. We cannot allow the long waiting time to prevent people from getting primary health care. We have to focus on prevention and rehabilitation. We have to allocate the resources wisely and bring collaboration between the private and public sector to respond to people's needs. So submit. Thank you. Ms. Maggie Chan. Madam Deputy, I've noticed that in Mr. Kingsley Wong's amendments, he mentioned healthcare voucher for women and also more screening for cancer patients. I agree with his amendments. We have been striving to obtain cervical cancer and breast cancer screening for women, for all women. I support providing healthcare vouchers for women and free breast cancer and cervical cancer screening for women. Women's rights is an important indicator for society. Because of our difference physically, women need more resources to monitor our health, especially women who have given birth. We need more care from society. According to a report in newspaper, most women are not receiving regular physical checkup performed by a gynecologist. Some consider it not necessary, and also the government has no program in place to subsidize these checkups. It is very important for the government to provide support to women in terms of healthcare. It is very important in terms of gender equality. I support providing free screening in terms of breast cancer and cervical cancer for all women. For women at different age groups, they have different needs. For those between at the age 20 and 30, we need a prenatal checkup. For women at the age of 40, they would enter a very different stage of life, and we have to give them a regular checkup to prevent possible complications. If the government can provide $1,000 to $2,000 worth of healthcare voucher for women to receive a specialist checkup, it will be very beneficial for us to receive a simple but effective screening. And also the healthcare vouchers should focus on both Western and Chinese medicine. Chinese medicine should be widely incorporated into our healthcare system. I suggest that the government enhance private and public healthcare collaboration and provide us with relatively to provide us with checkup packages at a reasonably low price. In terms of cancer screening, I reiterate, breast cancer and cervical cancer screening are very important. It should be made a free program. In 2008, there were 16,000 new breast cancer cases. Among them, 4,618 were new breast cancer patients, and 582 were new cervical cancer patients. In year 2014, 1,014 women died from these two types of cancer. These two types of cancer rank the third and the eighth in terms of fatality. Well, the first tier of our healthcare model should be prevention. The second tier should be screening, so that we can identify cancerous changes among women, so as to enhance the chance of recovery. Madam Deputy, I support rolling out healthcare vouchers for women, as well as rolling out regular free screening programs for all women. Time's up. Thank you. Mr. Stephen Wong. Dr. Stephen Wong. Madam Deputy, I support the original motion moved by Ms. Rebecca Chan. I also agree with the amenders. 30 years ago, the term primary health care appeared in government study. Still, progress was slow. I would like to identify the three major obstacles towards developing a better primary health care system. Why is this so difficult? Who should do it? And how we can do it? Why is it so difficult? In developing primary health care, we cannot just focus on primary health care. We cannot take primary health care out of context from the entire healthcare system. It is part of the integrated healthcare system. We need holistic planning. Collaboration and planning is very important. Under the integrated integrated healthcare system, there should be 4 components. First, primary healthcare and hospitals, and then hospitals and institutions and community services collaboration. Third, medical and health collaboration. Fourth, public and private collaboration. Every component under an integrated healthcare system are linked. We cannot just focus on the primary healthcare system. More importantly, we have to think about the collaboration between primary healthcare system with other components. We have to make sure that the players are collaborating. Under the current system, collaboration is very difficult among different bureaus and departments. So how can we achieve collaboration between the 4 components I mentioned? The government can consider adopting the policy of strategic purchasing as a tool to bring collaboration. Strategic purchasing is a WHO recognized financing tool. Governments and regulatory bodies can set up vision, and then there should be an assessment of the medical resources. In Hong Kong, the majority of the private sector plays a very important part. That's why there should be an enhanced version of healthcare voucher to provide screening for high blood pressure and high blood sugar and so on, and high cholesterol for middle-aged people, and encourage people to manage their health more proactively, as well as encouraging collaboration between the private and public sector. So who should be the one responsible for the integrated healthcare system? This involves changing the design of the governance structure. There are 2 major principles to consider. First, it should be people-centric. Rather than focusing on bureaucracy, we have to set up a very clear care pathway from prevention to treatments to recovery and infirmary care. There should be seamless connection. And also, we have to set out the goals and visions for our primary healthcare system under the integrated healthcare system. We have to think about the connection between prevention and treatment. We should focus not just on the community, but the linkage between the community and hospitals. For example, we have to define when a referral should be made, and after discharge, how can we ensure that sustainable healthcare services are provided to recovered patients? If we are considering a change of government structure, we can consider the collaboration between medical and health and social welfare. And also, we can consider establishing a primary healthcare authority. With government steering, more collaboration can be achieved with the hospital authority. The government should be more proactive in encouraging public-private partnership, promoting primary healthcare, and enhancing the integrated healthcare system. Thank you.
Mr. Lee Chan-Keung, thank you, Madam Deputy. Well, the saying goes that we should seek treatment early, but healthcare services have always been a matter of concern for the public. I thank Ms. Chen Hoi-yan for moving this motion so we can speak on the issue. In the 18 district governments is setting up district health centers to provide primary healthcare services for the public. But I believe these DHCs are just an important part of the primary healthcare system. The government funds these centers and they're operated by NGOs. Hopefully then we could shift the focus from treatment-oriented to prevention-focused. This is actually the current mindset of the people. We want to change that. And then in the long run, it could relieve the pressure on the public healthcare system. For services provided by the GHCs, I would suggest that apart from Western medicine services, Chinese medicine services should be included. Because Chinese medicine puts the emphasis on prevention rather than cure. So if we include Chinese medicine services, people will learn about their own health condition from an early age, and then they will, cultivate this sense of preventing disease. And also, we have these major diseases such as the high cholesterol, high blood sugar, high blood pressure problems, and then and elderly have to seek care, treatment. And I think the government should set up some form of central dispensary system, and medication could be sent to smart storage boxes near people's home. Then people no longer need to queue up for medication. And then we have the EHR and HA Go mobile apps. There is room for improvement for these electronic tools. Now, they should allow booking of services and follow-up consultation and other services. And then there should be information for family members so they know how their children or elderly are taking medication. Right now, the EHR is only accessible to private doctors and family doctors to learn about the medical history of their patients. And also, the system only allows people to check when they have made appointments. The government should make the most of the EHR and the HA Go system apps. They should be interlinked so people could have access to information with just a click. Now, people could see their medication records in the app, but if there is a central dispensary, then it will be easy for the public to check what sort of medication they've been prescribed, and they could receive notifications too, and there's need for further dispensing of medicine. And also, the EHR system should be extended to Greater Bay Area so we could cross the boundary, especially when we have the pandemic. There's no cross-boundary travel. Many Hong Kong people couldn't come back to Hong Kong for follow-up consultation, and they run out of medication. There were voluntary groups helping to send medication to Hong Kong residents, but this is not a standing arrangement. So there's need to have a cross-boundary central dispensary system. And then people living in the Greater Bay Area could also have access to medication. Right now, the HA system, if people want to learn about medical history, the EHR should be extended to cover Chinese medicine practitioners. And so members of the public will have another option to seek medical Chinese medicine services. Now, Chinese medicine practitioners could not refer patients to specialist service, or they could not refer patients for screening or gynecological screening and so on. So there are constraints on the services provided by Chinese medicine practitioners. So that this should be changed. Now, we may have all the hardware we need. At the same time, we need software. That means we need manpower. The problem is there is a long-standing shortage of manpower in the healthcare sector. That's why I think we should speed up the bringing in of locally trained doctors and other health personnel. So therefore, I support Ms. Chan Hoi-yan's original motion and Mr. Tommy CHEUNG's amendment. Thank you. Mr. Frankie Yik. Madam Deputy, I think... Dr. Teck Chi-yun, rather. Madam Deputy, I thank Ms. Chen for moving this motion so we have a chance to debate this issue. We've talked about it for decades, and we've raised various issues over the years. The government has done something so far, but there are also shortcomings. That's why I hope the Secretary and the government will really listen very carefully to our views, because we are trying to offer you various suggestions. I hope you won't just continue to do what you do without taking heed of our views, because so far members have been putting forward practical suggestions. Now, health is the most important asset for us. Health is also an important condition for us to ensure our quality of living. But then many Hong Kong people don't see that, and they don't actually cherish their own health. Now, I can give you some figures. There's a report prepared in 2016. Hong Kong is one of the cities with the longest working hours. On average, it's 51.11 hours per week. The average for the world is 36.23 hours. Beijing, the average is 37.42 hours. So actually, when we have long working hours, we really have the condition to talk about good health. Another figure is familiar to you. That is the Gini coefficient. Over the years, the Gini coefficient has remained at a high level. So we are ranked among the top places in the world. That shows we have a serious wealth gap in Hong Kong, and this has been a problem for a long time. So actually, when you see very poor people living in partitioned rooms, or for people who work long hours, you tell them, well, you need to take care of your health, you need to exercise, you need to watch your diet, you need to relax and unwind. But really, this is a luxury to these people because they simply don't have the condition for them to consider the issue of health. Promoting health is not just a single policy issue. This should be incorporated in all policies. So this is a so-called health in all policies. In labor policy, environmental policy, community development, education, and so on. So if this is health is reflected in all policies, that will help to promote health, public health. I could give you an example. There is this committee on the reduction of salt and sugar in food. Over these past few years, they've been promoting salt reduction in school lunches and in school meals, and it's actually worked very well. So you can imagine this is just a small step in education policy, and then students are having much healthier food. So health policy doesn't just involve a particular department or bureau or organization, but rather it should be coordinated measure. That's why the government has the duty to consider whether any policy to be proposed will benefit public health. Secretary, I see that in recent years you are actively promoting district health centers. I've worked with you in the past. I know you are very committed. You are always watching the progress of such projects, and I welcome that. Still, DHC is just an initial concept. So what is this positioning? What is the strategy? I think there's still plenty of room to discuss that. I understand the government has commissioned a university to conduct a study at DHCs. I hope you will discuss these study findings with us when they are available. So we need to see whether we have good policies to promote DHCs. DHC is not just a mixed policy that you just add bits and pieces of different services, but rather we should be talking about promoting a healthy lifestyle for the public, so people don't need to see a doctor when they stay healthy. So I have three suggestions for you about DHCs. One, DHC should be able to keep tab of the health status of the public. Now, the data only kept by the hospital authority, could they be opened up to the DHCs? And second, there should be a strong community network involving schools and so on, because DHCs, there's just one DHC taking care of hundreds of thousands of people. So it would a challenge, but then if you have a network, then it's easier. Third, case management. This is a very important part of DHC, so you need to consider that too. Thank you. Mr. Yang Wing Kit. Thank you. I speak in support of the motion moved by Ms. Hoi-yan on the 10-year plan for primary health care. Also support other amendments moved by members. Now we have a rapidly aging population. There's an increasing demand for health services for the elderly. Now we say that elderly should be taken care of and they should be able to receive proper health care. But then we know there's always a long waiting time for specialist service. The HA has released latest figures. The longest waiting time for that is Kowloon Central Ear, Throat, Nose Specialist, 154 weeks, Kowloon East, 152 weeks, and then another eye specialist service 147 weeks in another cluster. So people have to wait a long time, and then it takes 2 to 3 years to wait for a cataract surgery. And then people don't have teeth anymore because the public dental services only provide basic services such as tooth extraction. If they want to have tooth implant, it costs $10 or $20,000 in the private sector. So that's why the elderly choose to stay home, because they can't get the cataract surgery or they don't have teeth, so they will just survive on soft food. And at the end, of course, they will end up in hospital. So how can people in the grassroots sector be healthy and happy like that? Now there's elderly Singleton in my district. He has serious cataract. He can't really see well, and he has to wait over 2 years for public cataract surgery. And so he tries to avoid going up. But one day he had to go out to buy something, and he was almost hit by a car when he crossed the street. So we are seeing these cases day after day in the community. So do we not need to do something to help the elderly in the grassroots sector? That's why I support Mr. Kingsley, Mr. Everett Lam, and Dr. David Lam's amendment. We need to reform public dental care services. Apart from providing pain relief and tooth extraction service, there should be other forms of dental services such as tooth implant and so on. And also there should be service to prevent deterioration of oral health. And the government should give more subsidy to elderly dental care services. And now we have the school dental services, which should also have an elderly dental service program, and we should have mobile dental clinics. In the second 10-year hospital building program, the government should build a dental hospital. I agree with Mr. Edward Leung. The government should also prepare for a third medical school so we could train more medical personnel, in particular dentists and so on. And we could also bring in more doctors and dentists and other specialists to Hong Kong to deal with the shortage. In Wong Tai Sin, there's need for accident and emergency services. Last week, when the secretary replied to my oral question, she said that accident and emergency services should not be substitute for primary healthcare services. I don't agree with you, because accident and emergency service is part of the healthcare services. It's actually a form of primary service. Now, if people call an ambulance to go to accident emergency ward in Wong Tai Sin, it would take 20 minutes. If there's heavy traffic, then it could take 40 minutes. So how can that be right for when someone is in an acute condition? Now you say that the Wong Tai Sin Hospital is not meant to provide accident and emergency service because of the site constraint and so on. In that case, can we not identify another site in Wong Tai Sin so we could have an acute hospital there, and we could move the services of the existing hospital to this new hospital too, and then the other sites could be vacated for other purposes. I hope the Secretary will seriously consider my suggestion so there would be accident and emergency service in Wong Tai Sin. Thank you.